Fibromyalgia is a musculoskeletal disease look at this picture shows that musculoskeletal pain a detail going on. Introduction. Fibromyalgia is a chronic disorder characterized by widespread musculoskeletal pain, fatigue, and tenderness in localized areas. This condition significantly impacts the quality of life due to its associated symptoms, including sleep disturbances, cognitive issues, and mood disorders. The exact cause is unknown, but it is believed to involve a combination of genetic and environmental and psychological factors. The American College of Rheumatology criteria for fibromyalgia include pain in at least 11 out of 18, specific tender points on the body for at least 3 months. Definition. Fibromyalgia is a chronic disorder characterized by widespread musculoskeletal pain, often accompanied by fatigue, sleep, memory, and mood issues. Its exact cause is unknown, and diagnosis typically involves ruling out other conditions with similar symptoms. Types. 1. Primary fibromyalgia occur independently of other health conditions. 2. Secondary fibromyalgia develops in conjunction with other diseases like rheumatoid arthritis or lupus. 3. Localized fibromyalgia. Pain is confined to a particular region, such as the neck or back. 4. Generalized fibromyalgia, widespread pain affecting multiple areas of the body. Causes. The exact cause of fibromyalgia remains unclear, but several factors are thought to play a role. First factor, genetics. A genetic predisposition may increase the risk of developing fibromyalgia. Two, infections. Certain illness or infections may trigger or aggravate fibromyalgia. Symptoms. 3. Physical or emotional trauma, injury or extreme stress may initiate the onset of fibromyalgia. 4. Abnormal pain processing. People with fibromyalgia may have a lower pain threshold due to changes in the way their brain processes pain signals. Risk factors. 1. Gender. Women are more likely to develop fibromyalgia than men. 2. Age. It often develops during middle ages. 3. Family history. Genetic may contribute to an increased likelihood of fibromyalgia if other family members have the condition. 3. Rheumatic disease. People with conditions like rheumatoid arthritis or lupus are at high risk. Complications. 1. Chronic pain and fatigue. These symptoms can lead to a reduced ability to perform daily activities. 2. Mental health issues. Depression, anxiety, and mood disorders are common. 3. Social isolation. Constant pain and fatigue may result in withdrawal from social activities. 4. Sleep disturbances. Sleep problems worsen fatigue and cognitive function. 5. Impact on work. Difficulty maintaining employment due to physical and mental challenges. Pathophysiology. Fibromyalgia is thought to be central sensitization syndrome, meaning that the central nervous system becomes overly sensitive to stimuli. It involves abnormal levels of neurotransmitters such as serotonin and norepinephrine, which are responsible for pain perception and mood regulation. Additionally, increased levels of substance P, a neurotransmitter that transmits pain signals, have been found in the cerebrospinal fluid of fibromyalgia patients, amplifying pain perception. The pathophysiology of fibromyalgia is complex and involves multiple mechanisms, including abnormalities in pain processing, neurotransmitter imbalances, and heightened sensitivity of the central nervous system. Below is a step-by-step explanation of the process. 1. Genetic and environmental factors such as stress or trauma trigger changes in the central nervous system. 2. General sensitization occurs leading to heightened sensitivity to pain and other stimuli. 3. Imbalances in neurotransmitters serotonin, norepinephrine, dopamine, and increased levels of substance P result in amplified pain signaling. 4. Dysfunction of pain inhibitor pathways further perpetuates chronic pain. 5. HPA axis dysfunction affects the body's ability to manage stress and inflammation. 6. ANS dysregulation impacts the body's ability to manage basic functions, contributing to abdominal symptoms. 7. Sleep disturbances and psychological factors further aggravate the condition, perpetuating a cycle of pain, fatigue and cognitive dysfunction. This complex interaction of biological, neurological and psychological factors forms the basis of fibromyalgia's pathophysiology. Signs and symptoms. 1. Widespread pain, often described as a consistent, dull ache lasting for at least 3 months, affecting both sides of the body. 2. Fatigue. Despite sleeping for long periods, people with fibromyalgia often wake up tired. 3. Cognitive difficulties, referred to as fibrofog. This includes problems with memory, attention, and concentration. 4. Sleep disturbances, difficulty staying asleep or experiencing restful sleep. 5. Headache, migraine, tension type headaches are common. 6. Irritable bowel syndrome, abdominal pain, bloating, and irregular bowel habits. 7. Sensitivity to temperature, light, and noise. 8. Mood disorders, anxiety, depression, and irritability. Diagnosis. There is no specific test for diagnosing fibromyalgia. It is particularly diagnosed based on 1. Medical history and physical examination. 2. Widespread pain index and symptom severity scale. 3. Exclusion of other medical conditions. Blood tests and imaging studies are often conducted to rule out other diseases like rheumatoid arthritis, hypothyroidism, or lupus. Nursing diagnosis. 1. Chronic pain related to fibromyalgia as evidenced by complaints of body ache. 2. Fatigue related to poor quality sleep. 3. Impaired physical mobility related to muscle stiffness. 4. Disturbed sleep pattern related to pain and discomfort. 5. Anxiety related to chronic illness and unpredictability of symptoms. 6. Ineffective coping related to the chronic nature of the disease. Management. 1. Physical therapy. Focus on improving flexibility, strength and stamina. 2. Exercise. Aerobic activities and strength training have shown benefits in reducing symptoms. 3. Cognitive behavioral therapy (CBT) helps patients cope with the emotional impact of fibromyalgia and manage stress. 4. Relaxation techniques, deep breathing, meditation and yoga help reduce stress and manage symptoms. Treatment. Pharmacological treatment. 1. Pain relievers. Over the counter medications like acetaminophen or NSAIDs may be recommended. 2. Antidepressants. Medications like amitriptyline or duloxetine are often used to relieve pain and improve sleep. 3. Anticonvulsants. Pregabalin and gabapentin can help reduce pain by calming nerve activity. 4. Muscle relaxants. These can help alleviate muscle stiffness. Psychosocial medicine. 1. Counseling. Patients often benefit from individuals or group counseling to address depression, anxiety and stress. 2. Support groups. Sharing experiences with others can provide emotional relief and better coping strategies. 3. Family therapy helps families understand the disease and support the patient with daily life. 4. Mindfulness and relaxation. Meditation and stress reduction techniques are effective in managing chronic pain. Prevention. Currently there is no known prevention for fibromyalgia. However, managing stress, maintaining a healthy lifestyle, regular physical activity and early treatment of symptoms can help reduce the severity of symptoms and improve quality of life. In conclusion, fibromyalgia is a complex chronic condition that affects multiple aspects of a patient's physical, mental well-being. Although there is no cure, a multidisciplinary approach involving medication, physical therapy, lifestyle modifications and psychosocial support can effectively manage symptoms and improve the quality of life. Early diagnosis and treatment are essential to prevent complications and maintain functionality. Thank you. Have a nice day.